Comprehensive Perinatal Service Program, CPSP payment options. I'm Diane Mashinsky. I'm a registered dietitian. I have a master's degree in food nutrition education, and I have been a consultant for the CPSP program.
And I'm Michelle Chinaweth, and I'm a registered dietitian, certified diabetes educator, and partner and MNT reimbursement specialist.
And the disclosure for the seminar is that this is a resource and it doesn't define the standards of care in California. And this, we're encouraging you to look at your local facility level of care and patient population and use that as your resource, and that these are, don't use this as sole guidelines that's presented here. Also, this does not constitute legal, financial, or professional advice from MNT reimbursement specialists, and all responsibility for correct billing lies with the provider and the billing entities. At the end of the seminar, you'll have behavioral objectives. The participants will be able to list 2 bonus payments on the CPSP program, list 2 benefits of becoming a CPSP provider, identify 2 strategies to obtain bonus payments, identify 2 ways billing fee-for-service Medi-Cal CPSP differs from Medi-Cal managed care CPSP, and identify 2 ways to coordinate client care between CDAPP and CPSP. Comprehensive Perinatal Service Program, or CPSP, is a wide range of outpatient services to pregnant Medi-Cal recipients from the date of conception through 60 days after the month of delivery. It's a voluntary program for providers and clients, and these services are in addition to, but not a replacement for, the services that are part of the American College of Obstetrician and Gynecology, ACOG, visit standards. The CPSP model evidence shows pregnancy and birth outcome improves with early prenatal care, nutrition, health education, and services enhance obstetrical care. The goal of CPSP is to decrease and maintain decreased levels of perinatal, maternal, and infant mortality and morbidity, support methods of providing comprehensive prenatal care, prevent prematurity, prevent the incidence of low birth weight. The goals of Sweet Success is to promote quality medical management, including psychosocial and nutrition intervention for women with diabetes or for women who develop diabetes during pregnancy, so that their pregnancy outcome matches those of the women in the general population for intrauterine growth patterns, birth defects, morbidity and mortality of both mother and infant. It also promotes healthy lifestyle changes in order to prevent recurrent gestational diabetes or the development of diabetes after pregnancy, and to prevent the complication of diabetes among women who have overt diabetes. The coordination of programs and services, CPSP and CDAPP. You want to develop a referral system to the local CPSP provider. There are many in your county. Develop linkages through the electronic health record or fax communication with shared health records. Excuse me. Possible program overlap or integration. Sweet Success is CDAPP blue on the screen, CPSP is green, and OBGYN is golden, and those are the providers that are providing the prenatal care and postpartum care. Some possible program overlaps or integration. You can have a CDAPP program coordinated with an OBGYN. You can have a CPSP program, a standalone with OBGYN. And you can have a CDAPP, CPSP, and OBGYN program all together, and that is typically used in hospitals. Next slide, please. Some incentives for clients and providers of going into the CPSP program. First of all, the babies have a healthier start in life. and it provides enhanced Medi-Cal reimbursement to the CPSP obstetrical providers who are implementing the CPSP protocols in their practices. So who can become a CPSP provider? Well, a physician in private practice, family practice, obstetrics, or pediatrics, a group medical practice if at least one member is one of the physician types identified above, a physician group or certified nurse midwife, a preferred provider organization, an alternative birth center, hospital outpatient department clinic, community clinics, federally qualified health center, or a rural health center, and county clinics. So how do you apply to become a CPSP provider? Well, the easiest way to do that is to contact your perinatal service coordinator, our PSC, and there is a URL on the slide. Basically, you're going to go to cdph.ca.gov and search for CPSP program, and you'll find the perinatal services coordinators for the county or the city where you are. And they can provide you a list of nutrition, psychosocial, and health education consultants because you need them to put them on your application to be a CPSP provider. These consultants can approve your individual protocols and they can possibly see your high-risk clients. You can complete an application online, and it's the same URL, cdph.ca.gov, and just search for CPSP application, and it'll come up online. So you want site-specific nutrition, psychosocial, and health education protocols for each one of your organizations if you're a CPSP provider, and those protocols are due to the local perinatal service coordinator within 6 months of the CPSP contract approval. You can work with a perinatal service coordinator to develop new protocols, or you can customize the previously approved protocol template, which is online. Any changes in your staff, addition, or deletions need to be submitted to the local perinatal service coordinator as timely as possible. And this is just common for any insurance that you're doing billing with. A very nice resource is called Steps to Take. It's about, I'd say, 200-page educational topics for pregnancy and postpartum. Very nice book, very, very nice. And you have a provider handbook, both above. The resources can be found at web.cvent.com and then /event and follow the rest of the URL. The CPSP prenatal protocols and postpartum protocols are online, and your consultants will approve those. And if you don't like what's online, you can come up with your own. And as long as the consultant for nutrition and health education and psychosocial approve it, and you send it to the coordinator and it's approved, you're good to go. For federally qualified health centers or rural health clinics, you want to see Chapter 5 of the provider handbook because there's some specific resources for you.
CPSP reimbursement, Medi-Cal fee-for-service, and Medi-Cal managed care. Before we get into some of these numbers, remember that you don't memorize these. These are online and in this resource. So most of it is to get a big picture of what's going on for the additional funding that's available through CPSP reimbursement. When you look at the maximum reimbursement for obstetrical and CPSP education services, you're looking at $2,766. And of that, Part of it is the obstetrical care, the 1517, and this is very important, early entry. If you notice from the very beginning, we've talked about how important early prenatal care is, and that's both financially incentive here as well as quality of care. So you'll see there's actually a bonus for early care. CPSP support services all must be to get bonuses. Again, we'll look at early care, and we'll talk about those specifics in coming slides. But look at the financial incentives. It is positive. CPSP care and billing is divided into two sections, the physician services and the CPSP services that include the nutrition, psychosocial, and health education. There's an initial comprehensive assessment, nutrition, psychosocial, and health education assessments, perinatal education, individual and group, and postpartum. Again, the advantage is the bonus for early care. The client must be seen by contracted obstetrical medical professionals within 16 weeks of the last menstrual period to earn the bonus fee for the initial comprehensive office visit. And the devil is in the details. So documentation is essential and timing is essential. Initial comprehensive office visit, the procedure code is listed here, Z1032, with the modifier ZL only if it meets these requirements of less than 16 weeks since the last menstrual period. The advantage of the bonus for the initial comprehensive assessment, this must be completed within 4 weeks of the initial obstetrical visit. And each of these visits are, for the initial assessment, 30 minutes of the visit can be grouped together, the nutrition, health education, psychosocial assessments, and there's a special billing code for this early care, Z6500.
And I just wanted to mention, if you go back one, please, the nutrition is 30 minutes, the health education is 30 minutes, and the psychosocial is 30 minutes. So each one of those are 30 minutes. They're not grouped together. Okay?
Thank you.
Uh-huh.
And billing requirement for CPSP, the client needs to be eligible at the date of service. Only CPSP providers can use and can bill the Medi-Cal for the CPSP procedure codes. The reimbursement for nutritional, psychosocial, and health education services is made on an itemized per visit basis. This is not a global fee. To bill the visits in excess of the maximum units of service allowable requires a treatment authorization request, TARS, for the nutritional, psychosocial, and health education services. What you'll find also within this is there are lots of units available for health education, so you want to make sure all units are used prior to requesting a TAR.
And they're listed as perinatal education.
And we'll show those codes as we proceed.
Yes, we got.
Adequate medical record documentation to verify services rendered is without saying, but it's important that you plan your charting accordingly so that it's easy for reimbursement and for verification. For billing CPSP and Medi-Cal managed care, it requires a CPSP contract. It requires a contract with each of the Medi-Cal managed care plans. This was reiterated previously in one of our other videos, saying that it's very important that you know which insurance plan the client has so that you know that you are a provider of that plan. All managed care enrollees are eligible, and they must have the services included in your Medi-Cal managed care contract with the billing codes and reimbursement rates listed. For billing Medicare CPSP services and Medi-Cal managed care, You bill the managed care, not Medi-Cal. And you may need prior authorization for high-risk referrals. Again, this is another reminder that the providers, billing, and contracting must have a communication system in your facility. The services covered in CPSP, the OBGYN services, and there's a limit on paying for the Z1032 code listed below. Nutrition, client orientation, health education, case coordination, and psychosocial. The billable CPS services to fee-for-service Medi-Cal include the obstetric visits, the nutritional, psychosocial, health education, and vitamin and mineral supplements. We talked briefly about the treatment authorization request for additional services. And to do this, as with all TARs, you have to have the number of services requested, the time, and anticipated benefit or outcome for the additional services, the clinical findings of the high-risk factors involved in the pregnancy, the description of the services being requested, the expected date of delivery, the explanation of why the basic CPSP services will not be sufficient, and ensure that you have utilized all of the allowable units for perinatal education. That there are TAR exceptions, as with anything regarding the state system, and that is the federally qualified health centers, rural health centers, Indian Health Service. They need the same medical justification that the fee-for-service provider, and it's included in the medical record, but they don't go through the same paperwork. But it's important the documentation is there. Some examples for CPSP codes. Remember, these are not memorized, these are located, and one of the easiest forms to use is the billing summary. And you see all these numbers, whatever, but it really is an organized way to look at the number of units for each one of the services and to be able to document it so that it's easy for your billing people as well as your office scheduling to make sure that your people are on that. So as we look at physician procedure codes, the initial comprehensive office visit listed. And again, we will reiterate, this is time sensitive. It's before 16 weeks of the last documented menstrual period. So this is very important. It can only be billed if it meets all of the requirements. And the special bonus code is Z1032 with a ZL modifier. This is why your billing people are so helpful to make sure that you've documented what you need and that you've also know that you're going to get reimbursement. Also, the prenatal vitamins have a special charge, and there is no bonus fee for this. And providers may bill each time they dispense a 30-day supply. But there is a limit of only 10 30-day supplies in 9 months. The initial comprehensive assessment, also known as a coordination fee. Remember that one thing we know about programming is that what we name things changes. So a lot of times we need to remember there may be 2 names for the same service. This code is Z6500, and it's only used, again, the devil in the details, it's only used if all 3 assessments were completed by the timeline of within 4 weeks of that initial obstetric visit. And it's 30 minutes each of nutrition, health education, and psychosocial assessment. And all of those must meet the timeline. If one of them was a week later than that 4 weeks, you cannot use that billing. For nutrition codes, they go Z6200 through Z6208. There are group and individual services can be provided. And you only use certain codes if the timeline was not met. For psychosocial, it's Z6300 through 6308. And again, There's only the initial code of 6300 is only used if the timeline was not met for the comprehensive. For health education, these start off a little different in numbers. It's Z6402 through Z6414. And again, the 6402 is only used if the timeline was not met for the initial 6500. All of these are detailed online, and the URL is provided for you at the end of the program. The initial visit, the comprehensive visit, 30 minutes of each, is 1.5 hours or 6 units. There's no modifier used with this billing code. If it's greater than 30 minutes used for any of the initial assessments, then additional units can be billed for that day of service under these separate codes. So you can see, again, the detail is important, and the provider, the billing, and the contractor in your facility really need, when you've become a CPSP provider, to know the details. There's no additional bonus fee for additional units. Anytime units for the first assessment can be used, but only up to the 1.5 hours for each assessment component. And when we're looking at pricing, you'll see the initial comprehensive assessment pricing, and that's a flat bonus. For individual support services, nutrition, psychosocial, the per hour rate is $33.64, and the maximum hours are listed here, 21.5 hours. For group education classes, you'll see that the group class rate is lower, but there are more hours allowed, 27 hours. And the case coordination fee, also known as the comprehensive assessment bonus, is listed above. And look at the total support services possible income, $1,112.08. I like the 8 cents. And for maximum billable hours under each one of the education pieces, nutrition, psychosocial, and health education, again, it's important to know, and that initial form that we showed you on how many units can be documented is a nice flow sheet. 8 hours for maximum billing time for nutrition, 10.5 for psychosocial, health education, 31.5. There's group and individual listed. There are other reimbursement opportunities in coordinating client care. Obstetrics provider can refer those with GDM, type 1 diabetes and type 2, and those at risk for type 2 to one or more of the following services: to your CDAPP program for preconception counseling, for the diabetes prevention program if they're at risk for type 2, the CDC lifestyle change program. They can be referred for medical nutrition therapy, and for type 1, type 2, and gestational diabetes for diabetes self-management training, education, and support. The options to coordinate programs and services: you could become a CPSP provider, you can refer to a CPSP provider, and contracted CDAPP, Suite Success practitioners with a local CPSP, you can contract with them to provide the consultations for their high-risk clients. So there's good potential for coordination of services.
And where do you find these people? You go online and talk to the perinatal service coordinator in your county or city, and you'll get a whole list of CPSP providers in your region or in your city.
That is a point person in your community to contact when you have any questions regarding the CPSP program. We are now in the public health emergency. It's now continued more than 2 years. And because of this public health emergency, the federal government has allowed flexibility in offering telehealth and virtual services. They have relaxed the face-to-face visit rules. This, however, is a time frame of 90 days, and the U.S. Secretary of Health and Human Services can renew this public health emergency every 90 days. At this point, it's renewable through July, so we'll be watching for the renewal. For telehealth in California, the Department of Healthcare Services, DHCS, has posted guidelines on telehealth flexibilities on their website. And it's important to check with those because the state guidelines might be a little bit more specific than the flexible guidelines. The federal guidelines will expire at the end of that 90-day period. What the state does will depend on the federal, but you need to know what both levels are. The advantage of telehealth, as we all know, has been a boon for service this last 2 years. The client can be at home and the provider can be in an approved location by the employer. So it has allowed us to continue care. When you look at telehealth and CPSP, when billing Medi-Cal fee-for-service, the CPSP visits via telehealth have been covered temporarily. So again, everything you need to keep in good communication, your billing services, your contracting, and your providers. The instructions for the telehealth is on page 10 of the dhcs.ca.gov COVID guidelines. And also there's additional guidelines that are listed and are pretty succinct from the Public Health Department of LA County, publichealth.lacounty.gov. And these URLs are in the resource listings at the end of the presentation. These are the resources and the URLs for all of the programs that were listed and the education resources that are listed, the Steps to Take booklet, and many others, applications. So you can use these references to go online to find the specifics. We always give an acronym page because we know initials change, and it's what's so confusing about state and federal programming. We thank you for your time today. We know that some of the details get a little overwhelming, but the overall picture is coordination of care is available for diabetes and pregnancy program, the CPSP program, the obstetrical care. So we do thank you for your time, and we thank you also for your service.
And we appreciate that all of you would look into being CPSP providers. As a consultant, I will tell you it's a tremendous benefit to the client as well as to the provider. Thank you so much.